Hi, I'm Jenny with Life's a Polyp blog. In the last couple of years, I've been having a lot of increased problems GI-wise. I've been having a lot of early fullness and nausea, abdominal pain, not vomiting usually, although I want to. And so what I found out recently, as this worsened over the last 2 months to the point of where I couldn't eat full meals, I couldn't eat 8 ounces of soup without feeling like I was about to vomit. I was so full. And that decreased down to 3 ounces of liquid, and even just a sip of water being a problem for me. So what I found out was that I have C. diff infection. Now, C. diff is a really bad gut bacteria. It actually exists all around us in the air, water, soil. It's in our feces and that of animals as well. And most of us actually have that bacteria in our intestines, but it doesn't always lead to infection. So proper like hand washing hygiene is really important for infection control, but most of us, or a lot of us, encounter that in like hospitals or around chronically ill patients, such as nursing homes or medical facilities, things like that. So I'm not sure exactly where I got the C. diff, because I've been in the hospital a lot my whole life, and it could have colonized in my colon when I had a colon at that time, or I could have gotten it from one of my patients, because I work in the medical field, and so I have patients periodically who have C. diff. But regardless, even without a colon, I was able to get a C. diff infection, and a lot of the symptoms is diarrhea more than 10 times a day, severe cramping, fever, nausea, loss of appetite, weight loss, dehydration, rapid heart rate. Well, because of my short bowel syndrome and my adhesions and not having a colon and not a full small intestine, I actually have all those symptoms except for a fever and rapid heart rate. So my doctor and I had no idea to even suspect that I would have a C. diff infection, that might be causing my increased symptoms. But I started on antibiotics, and I've started being able to eat. I've gained 4 pounds in 3 days, just because I'm able to eat now. And so what I've taken away from that is not only is it important to always practice hygiene, which I know, especially working in the medical field, but to reiterate that to anyone and everyone. But also, you never know what it might be when you're having health issues, so be sure to always press your doctors to continue looking for solutions to your problems. There may not always be a solution, but sometimes just knowing what it is can be helpful, so you know how to at least then manage it the best that you can. But never give up, and don't let your doctors give up on you. My last doctor chalked my symptoms up to adhesions, and adhesions alone. But my new doctor did more testing, and not to say that I had C. diff for 2 years, but he promised me that he would continue to look for answers for me if it wasn't just C. diff. So continue pressing on. And thanks for watching, and I'll talk to you soon. Thanks for watching. Be sure to subscribe and like. Also check out Life's a Polyp blog and shop, and I'll see you soon.